Hi, welcome to Healthcare Delivery Systems Week 1. First off, thank you for enrolling in our Health Information Technology program, and I wish to welcome you to this course. I'm your guest lecturer, Rhonda Seibert, and assisting your instructor, Amanda Stortz. Just a little background, I graduated from Northeast Iowa Community College many years ago in the Health Information Technology program. I worked in healthcare for several years before returning to the college as faculty, and as still the program director for the program and provide oversight for it. After I graduated from NICC, I continued on in college and obtained a bachelor's degree and eventually wrote the exam for a registered health information administrator and then returned to school for a master's in education. So I've been with the college for many years in many roles, and it is a privilege for me to assist with this course and provide some guest lecture. This week we have PowerPoints for each week, and I just want to let you know that I am not going to read these PowerPoints to you. The transcripts are provided in the course, and you will need to look at the PowerPoints and the transcripts one-on-one to provide a little bit more depth for you. My intent with these videos is just to go over some of the highlights and some of the areas that will be important to you in future courses or what you're going to cover in future courses. So let's go ahead and begin. This is first week is pretty low key. This week we talk about just an introduction to everything that you're going to do in this course. So this is the introduction to history of modern healthcare. So one of the first things every textbook will talk about is what is health, and health is just simply being the absence of disease, and that was defined by the World Health Organization. But they say not only free of disease, but a state of health is that good space where your emotionally, mental, social well-being, that is health. So illness on the flip side then is supposedly a state of poor health. So when they talk about health care, they're talking really about the prevention and treatment of illness, but it's delivered by different people and different disciplines, and these are listed here on your screen that you can see. All these people today come together to form an interdisciplinary team to help deliver care. So then you get to health care delivery. Delivery is health care provided in different places. So one of the first places can be your inpatient facilities or hospitals, which we'll talk about, I believe, in week 5. But hospitals basically are institutions for treating sick or injured people. Back in the early days, they were known as almhouses. One of the significant things about hospitals is called the Hill-Burton Act, which is mentioned here. Hill-Burton was passed in 1946, and one of the things that it did that was very significant, it was provided funding for the development and construction of hospitals. Many of our small towns in Iowa and our small hospitals, if you look when they were constructed, a lot of them were after World War II, and a lot of them were constructed under the Hill-Burton Act. Without this, healthcare services in many small towns would have been non-existent. Healthcare delivery then, we have different kind of hospitals, which we'll talk about in a later unit. But hospitals, not one size fits all. Everyone's a little bit different. They have the same basic services, but just a little bit different in how they're run. Then besides hospital, we have nursing and residential care facilities, or you may call them nursing homes. They can be short-term care or long-term care. They're classified by their level, whether it's skilled care, intermediate care, or residential care. They became quite popular after an amendment to the Social Security Act, and funding became available to help them. But then gradually funding shifted for them, and it's a little bit different model today. Healthcare delivery then, we had nursing and residential care facilities, and they have gone through an evolution. In the 1990s, they actually evolved to a state called subacute care. And subacute care is when a person isn't sick enough to be in the hospital, but they're not well enough to go home, and they still need some type of skilled level of care called subacute. So that really proliferated in the 90s as a cost savings measure. Then, after we get out of inpatient, we have all kinds of outpatient facilities. You can go to a physician's office. You can get a primary care physician, which is our doctor, as we call them. Specialty care offices, single specialty or multi-specialty. We have dentists, we have labs, we have ambulatory services, we have rehab services. All of these we can get on an outpatient system. The healthcare industry in the United States we will cover in a later unit, but it is big. It's one of the largest industries in the United States. And notice down here it says hospitals only constitute 1% of all healthcare establishment, but they employ 35% of all healthcare workers. Even in our profession, the majority of our graduates end up working in some type of hospital setting. So they are a very large employer and important. The next one is a slide of the organization of healthcare. You can see the types of services and what percent employ and the number of establishments in the United States. Then we get into healthcare systems. So we have healthcare delivery now systems. A system is an organization that delivers healthcare. There are many different kinds of systems across the world. They all promote good health and populations. There are different models. You can have public healthcare systems like care conducted at the state level. You can have private, where it's funded privately, like the Shriners Hospital. And in some countries, the states actually run the healthcare system. You also, in the United States, we have no universal health care. Although it's talked about all the time how much better everything would be if we just had universal health care, but we don't have it. We do have public and private components, and our public healthcare systems are very organized. For example, the VA hospitals or your Veterans Health Administration. Then you got partnerships between the federal and the state level to provide systems such as Medicaid and the CHIP insurance program. These are all going to be covered in week 11 of your course. Second healthcare systems are privately owned commercial organizations. They also act as a healthcare system. So these organizations can serve a single area or multiple. They can be for-profit or not-for-profit, many styles. Healthcare systems use a word called benchmarks. One thing that's really important today, and we talk about this in the last unit of this course, is quality. And how do we know that the service that anyone is getting is quality? They use a system called benchmarks, where they compare facilities and services of a similar size to someone else. So they set a benchmark, such as the rate for hospital readmission should be no more than X%. And if you have one hospital with a higher readmission rate than the average, people want to know why. Do you have a sicker population? Is there a quality issue? What's going on? But benchmarks are very important in today's world for accountability. And funding often gets tied to performance, benchmarks, and quality initiatives. This part is interesting. Core values. Healthcare in the United States has changed dramatically in the last 50 years. Today, our core values in the United States is patient-centric care and individual choice is very important. You'll see ads on television. Your doctor, your choice. Interdisciplinary care. You don't have one caregiver. You have a team in today's world. They take care of you. Technology and innovation. Technology is huge. People want technology. They demand technology. They want the best. Another core value is cost. The options for financing healthcare: taxes or revenue, social health insurance, voluntary or private health insurance, you pay out of pocket, you can have donations, but cost of healthcare is financed by many different pots. Expenses continue to escalate and people are worried about it, but it's still not controlled. Another paradigm shift is from physician-centric to patient-centric care. Back in the day, the provider, your medical care provider, what they said was the rule and you followed it and people did everything their provider tell them. Now, patients want to be more involved in the decision making. They want to know all the risks and the benefits. They want to make the right choice. And the provider can give advice, but the patients make that. So this new model is a shift toward giving patients more responsibility in that care. Another paradigm shift in medicine is the Patient Self-Determination Act. We don't really talk about that in this course much because we cover it quite heavily in legal aspects of information, but the Patient Self-Determination Act gave patients the right to make their own health care decisions, and hospitals are legally obligated to inquire if a person has their decisions made. They cannot force one, but they do have to ask and provide information when asked. Another shift is team-based care. Healthcare today is too massive for one person to be your sole provider of care. They realize that a state of health is more than just treatment. It's a whole aspect, from your social well-being to your physical well-being to your care that you have at home, what resources a person has. So it's a team-based care. They talk about patient-centered medical home that you can read over in your notes. Then they talk about physician-kept records to personal health records, a major shift. Your health record belongs to you. The information in it belongs to the facility. They own the physical record, but you have a right, except with very few limitations, to get access to your record. So the current trend is that you can access your personal health record. So if you have a primary care physician, you have the right to go set up your own account and look at your record. Another paradigm shift in medicine is still the overuse of the emergency department for health care. Many people don't have a primary care physician, so it's easy to walk into the emergency room and get care. But that walk-in has a cost implication and a care implication. And there are many reasons for this, but it's been a problem for the last 30 years that isn't going away. And we'll talk about that later on in the course. The other thing that's changed, the electronic health record. You're going to hear about the electronic health record for the next 2 years. And for you, you're really coming into this. The electronic health record is here. It's just here. You're using it. Whereas us who've been in the profession a long time that went from paper-based to electronic, it was a transition. The electronic health record has lots of advantages over paper records. First time I ever worked in the industry, the first file I had to find, couldn't find it. It wasn't on the shelf. Looked and looked and looked. Not that way with the electronic health record. So the advantages over paper records are listed here. And then they talk about your personal health record. It's been around for a long time, but with the electronic record, you can get access at any time. Another thing about personal health records, everybody will say, what about privacy? What about privacy? These all are being answered today. Who owns that data? Who can get access? How do they get access? What do you have to tell the person to get access? What do they do with their PHR? What if someone breaks into their PHR? It's here. Those privacy concerns are addressed by the healthcare facility. Then you got technology in clinical medicine. Technology in the medical offices. Today, when you go out in the work world, you're going to use billing software. You're going to do insurance claims processing. You're going to do accounting. You'll see computer-assisted surgery. You'll see CAD technology in medicine as they build prosthetic devices. Technology is here. Telemedicine is here. It's an alternative when a person can't get access to their demographic region. We can transmit images. We can do many different things. We also have pharmacy, dentistry, radiology, and rehab, and education. So everything that you see here is what we're going to cover in this course. It's a little bit about everything. It's a lot of behind the scenes work, but everything you do in this course is going to be a foundation for the next 2 years. You're not going to hear it once. You're going to hear some of these things over and over again. But by the time you graduate, you're going to be a well-qualified health information professional. So again, welcome to the program. Welcome to the course. Hope you enjoy it, and best wishes to all of you.